Yeah, hi. So I'm Yao. I am neurogeriatrician. Now I'm working in Lille. It is in the north of France. Um, I'm mostly working in the memory clinic. So I'm have patients with cognitive disorders, and I'm also helping with the caregivers. The other part of my work is in the geriatrics and also in the force clinic and to help people to prevent gait disorders as well. Yeah, of course. So here's the training. So at the beginning, I was very intrigued by this training because I think it's so different from things that I got before in my past. So I was first very curious about that and intrigued. But actually, from this training, I think the most impactful for me is the way that we can have to give voice to people and how we can better listen and retell the story. That is the most impactful. But at the same time, I think it was also for me as academic and also a physician a way to learn some methodology about qualitative studies. It is not a training to get a methodology for qualitative studies, but I think it's the first step, a kind of introduction to know how to conduct this kind of studies. I was completely ignorant about this kind of studies. So yeah, I think this training was really, really useful for me. Well, that is why I said that is kind of introduction for this kind of qualitative studies. Well, of course, I think it also helps me to better listen to the people that I care for, but also one part of my work now, I still work with some researchers in Trinity College in Dublin, and we studied the impact of COVID on mental health of staff who are working with people with intellectual disability. And I think without this training, I was not able to lead this kind of study. So my work there is um, to invite people in this kind of face-to-face interview, and I will listen to them and then record this transcript. Record the interview and give the transcription, and then take some quotes from these interviews, and we are doing this work right now. So without this training, I think I was not able to do that. So that is the first part, I think, where really have which really still has this connection with the HSA training. And the other part is also COVID related. It is an international online study about the loneliness and the social isolation from the caregivers. And that part, it's mixed. It is a mixed study actually. So we will have quantitative data, but also qualitative one. So I feel more confident also to lead this part of analysis. Now I had this HSA training. And the third part is not really, I mean, I'm not really putting in practice right now, but it opens my mind to this possibility of of research, or to this possibility of interaction. And we have this project with other GBHI senior fellows to give voice to caregivers, and especially female caregivers in different countries. And we will use this method learned in hearsay training to develop our project. So this is not this is really an ongoing project, but yeah, I think this will be the third part, which will really be connected. Mm.